This is POC Nurse. Let's talk about basic life support, how to pass the exam, and why you need it. Why would you need BLS? So, I made this video for new nurses that are getting into nursing school or starting their new jobs in a facility. But it also goes for other people who are also looking into working in healthcare or in positions where they may require BLS certification. So, why would you need BLS certification? Well, if you're working in places where people are sick, there's a high chance that you would need it in case someone's heart stops or someone is not able to breathe. If you're working in places such as a daycare or a place where people gather, a church, it is always advisable to have people who are BLS certified because in those situations, you can also come across people who could have trouble breathing or whose heart could stop. So, essentially, you need BLS so that you can provide CPR services, for lack of a better word, to people who need it. And who needs BLS? Who is a recipient of BLS services? Someone whose heart has stopped or someone who's having difficulty breathing. So, as a new nurse going into nursing school, you need to be BLS certified before you start going for clinicals in whatever facility you're going to. And as a healthcare worker, you also need it. In some facilities, hospitals, even the janitor needs to be BLS certified. The clerk, the techs, the nurses, the doctors, the respiratory therapists, the x ray techs, almost everyone that works in a hospital needs to be at least BLS certified at the minimum. So, in this video, I'm only going to talk about one part of the BLS certification for healthcare workers, which is the exam portion. But it's basically the knowledge portion for your BLS certification class. So the class consists of two parts. You have to take an exam based on knowledge, and you also have to do the practical aspects of it, which is the actual compressions and ventilation. So in this video, I'm only going to talk about tips to help you pass the exam portion of it because you will get assistance with the practical part. The exam portion you have to do yourself, and for the most part it's open book, but here I'll give you tips on how to pass the exam part of your BLS certification. So moving on, what does BLS involve? I'll tell you a story. One day when I was still working in labor and delivery, I was going to work, but during that time I also worked in the ER full time. So I worked in the ER full time and worked in L&D per diem. Prior to that, I'd always worked L&D. So I was going to to work in L&D in a big facility, and I used to go in through the ER. So as I was approaching the ER entrance, I saw a nurse doing compressions on a patient outside of the hospital. Now, the nurse had her bag next to her, which means she was going home. So I walked up to her. She was obviously alone. I told her I was going to go get help. So I went inside. I told the ER folks there's someone doing compressions outside. She needs help. Before I even left to go upstairs, they had a stretcher. People were running outside to go grab the patient and help the nurse. So the first thing about BLS that you need to know is that you find someone who's slumped over, someone who has collapsed, someone who is having trouble breathing. The first thing is that you notice that person, right? Once you notice that person, what's the first thing you should do? Make sure the scene is safe. Ensure scene safety. You don't want to go into a situation where you become a patient. So you want to ensure scene safety. Once you see that the scene is safe, you can approach the patient. The next thing you have to do is make sure this person is not sleeping, right? You have to make sure that they are really and truly unresponsive and need your help. So to do this, you have to stimulate a response from the patient, which is tapping and shouting at the patient, tapping the patient. I wouldn't say, vigorously, but just enough to get a response from someone who's reasonably conscious. So, for example, the way you would tap someone who's sleeping to wake up, vigorous enough to wake them up, but not vigorous enough to cause them pain. And you would tap and shout, "Hello, hello, are you okay? Are you okay?" If you get no response, the next thing you should do is ask someone to go get help. Because once you start um, working on the patient, you may not be able to go get help and get the help you need as quickly as possible. So before you start anything, once you know this patient is unresponsive, ask someone to call 911 and grab an AED if available. So if you're a nurse working in the hospital and you're on the floor, you go to check on your patient, you notice the patient is not responsive, you want to call for help before you go in and further assess the patient. So you tap, you shout, no response from the patient. You ask someone to go get help, call 911, grab the AED, call a code, and bring me the code card, depending on where you are. Once you do this, the next thing you want to do is establish what the issue is. Does the patient have a pulse? Is the patient breathing? So, to check for a pulse, you would check for carotid pulse. While you're checking the pulse, you're also looking for breathing movements. Is the patient's chest rising? Do you feel the patient's breath on you in any kind of way? If you establish the fact that the patient is not breathing, the patient has no pulse, what you want to start doing right away is chest compressions. So, when you start chest compressions, you want to do it hard and you want to do it fast. For your test, you need to know that the ratio of compressions to breaths. So you do 30 compressions and then you give the patient 2 breaths. What about the compression rate? How fast should you provide the compressions? The way I remember it is that you do 2 compressions in 1 second, right? Um, in 60 seconds, that's 1 minute, you should provide 120 compressions. So for American Heart Association CPR, you should provide 100 to 120 compressions in 1 minute per minute. You also need to know this for your test. Secondly, what is the compression depth? You need to compress at a depth of at least 2 inches or 5 centimeters for adults, and this is a third of the patient's chest depth, a third of the depth of their chest. Now, when you compress, you need to let the patient's chest wall recoil by itself before you go in for the next compression, before you go in and push the chest down again to allow the heart to refill. Now, while you do all of this, wait for the chest to recoil. You're checking for breathing movements. You're checking to see if the patient has a pulse. It's important to spend no more than 10 seconds doing all of this. The longer the patient gets chest compressions, the better their chances of surviving are. So it's important to spend more time doing compressions than allowing interruptions to railroad um, chest compressions. Another thing to note is that compressions can be tiring. So if you have two rescuers doing compressions, one doing providing CPR or BLS, one person is doing chest compressions, one person is giving breaths, one person is ventilating. During CPR, you want to stop every 2 minutes to check the patient's pulse. At the 2 minute mark, it's good to switch compressors so that the new person that's compressing is less tired. When you do compressions and you're tired, your compressions aren't as fast and they aren't as deep. So those compressions would not be good quality compressions. So to maintain good quality compressions, a good rule of thumb is to switch compressors every 2 minutes. So the new person that's coming in to start compressions is relatively less tired than the person that just finished compressions. Now, next thing we're going to talk about are the ventilations. How often should you provide breaths to the patient? For adults, you should provide one breath every 6 seconds. So that would be about 10 breaths per minute. Make sure with each breath that's provided that there is noticeable chest rise, visible chest rise. If there is no chest rise, that breath probably is not going into the lungs. If you are not obtaining chest rise with each breath provided, you can reposition the patient. And remember, it is one breath every 6 seconds, and each breath is delivered over 1 second. And, you know, for the real life scenario, if you're working in the hospital, you will have a bag valve device bag mask device to provide ventilations. And the bag is a 1 liter bag. And when you squeeze the bag, you could squeeze the entire bag or squeeze a little bit of the bag. It's a good rule of thumb not to squeeze the entire bag to prevent a pneumothorax. So you want to kind of squeeze half the bag when you're providing breaths, and you want to squeeze it every 6 seconds and over 1 second each time you squeeze the bag. So that's it for ventilation. Now we're going to talk about the AED. So once the AED arrives, what is the first thing you should do? If you get a phone that is dead, what is the first thing you do? If you get to a computer that is dead, what is the first thing you do? I mean, not dead because the battery is dead, but off. The first thing you do is turn it on. The first thing you do when you get an AED for your BLS exam is turning it on. So once you turn it on, the next thing you do is follow all the instructions that the AED will give. So you would want to expose the patient's chest and apply the pads that come with the AED to the patient's chest. And usually the instructions for placement of the pads are on the pad. You'll see pictures with a person's chest and where the pads should go. So you would place the pads as instructed by the manufacturer. Once the pads are placed, the AED will analyze the patient to see if their cardiac rhythm is shockable or not. If it is a shockable rhythm, the AED will advise that a shock will be given, ask everyone to clear the patient so that just the patient gets the shock and not the patient and the people helping the patient, because then you get have more than one person requiring BLS. So everyone would need to not be touching the patient physically when the AED is given a shock. And once the shock is given, the next thing that needs to happen is that CPR continues immediately. So typically, CPR will go on for 2 minutes, and then the AED will analyze the patient's rhythm. You check for pulse. If a shock is advised, it will be given, and CPR will continue. If no shock is advised, CPR should continue. Now, early defibrillation increases a patient's chance of survival. That's why you want to attach you want to start using the AED once it gets to the scene. So you want to turn it on, follow the instructions, which would include attaching the pads and then following all other instructions that the AED will give. Next, we're going to talk about choking in adults. So you will all know the universal sign of choking. The patient will have their hands around their neck. So if you see that, what you want to do is abdominal thrusts, which is the also known as the Heimlich maneuver. But the important thing, if this patient becomes unresponsive and their heart stops, you will want to start CPR immediately. Very important, before giving any breaths to a patient who became unresponsive due to choking, due to something being lodged somewhere in their airways, you want to look in the mouth, see if you can visualize the object and pull it out. If you cannot see the object, you should not do a finger sweep, meaning you shouldn't put your hands into the patient's mouth trying to feel around for the object, because you might push it down further into the patient's airway. If you don't see the object, Give the breaths as you should and continue with CPR while you wait for help to come. Now, very important, check the mouth for the obstruction before giving breaths. Let's talk about some special considerations in BLS or CPR. If the patient is submerged in water, they need to be pulled out of the water before they get shocked. If the patient is laying in a small puddle, it would be okay to give the patient a shock. Before applying the AED pads, if the patient's chest is wet, wipe it dry. If the patient has a hairy chest, the AED pads may not adhere to the chest properly. If you have a razor, you can shave the patient's chest. If you don't have a razor but have two sets of pads, you can do like a mini waxing. Apply the first set of pads, rip them off so you can get as much hair as you can off of the patient's chest, and then apply the second set of pads. Now, some patients have defibrillators. It's usually felt like a lump under the chest. Don't place the AED pads over the pacemaker. It should be placed away from it. Some patients have medication patches. Also, don't put the AED pads on the patches. Remove the patch, wipe the skin, and then apply the AED pads. We already talked about interruptions while you're providing CPR. You shouldn't spend more than 10 seconds doing anything. You should spend less than 10 seconds, if possible, doing anything, checking for the pulse, checking for breathing. Now, we want to spend 80% or more of the time spent during CPR doing high quality chest compressions. Now, sometimes if you have enough equipment while you're providing CPR, you can measure something called the patient's end-tidal CO2. The normal value for this is 35 to 45 millimeters of mercury. But if you're providing CPR to a patient and their end-tidal CO2 is 10 millimeters or more, you are providing good compressions, good quality compressions. If the end-tidal CO2 is less than 10 while CPR is being provided, then the quality of the compressions need to be improved upon, right? So now we can provide BLS or CPR services to adults, to children, and to infants, right? There are few differences in all three. So to recap, here's what applies to everyone almost. You want to make sure the scene is safe. You want to stimulate a response from the person to see if they are actually out or just sleeping. You tap on the person, are you okay? Are you okay? For the baby, you have to flick the baby's foot to try to stimulate a response from the baby. If there is no response, you would call for help, you would start CPR. Now, for the baby, if you were there when the baby collapsed or went down, you can call for help first and then start CPR. If you come in and find the baby unresponsive, you want to do 2 minutes of CPR before calling for help. Okay, this one's important to know. If you witness an infant collapse, go call for help and then come back and start CPR. You can bring the baby with you if you have to take the baby with you to where the phone is. Now, if you did not witness the collapse, you want to do one full set of CPR for 2 minutes or 5 cycles of CPR before you go call for help, come back, and then continue CPR. Now, to check the baby's pulse, you have to check to see if the baby has a pulse, you have to check for a brachial pulse. A brachial pulse you check for in inside the patient's in the crease of the patient's elbow. All right. Also, for children and infants, you want to provide as many breaths as possible. So if you have one rescuer, you do 30 compressions to 2 breaths. If you have two rescuers, you do 15 compressions to 2 breaths. So in this case, you'll be providing more breaths. Now, this is for children and this is for infants. Also, you provide breaths for children and infants every 2 to 3 seconds, as opposed to adults who get breaths once every 6 seconds. For children and infants, it's once every 2 to 3 seconds. For the infants, you can do compressions with one hand or both hands. If you are by yourself, most likely you would use the one hand technique, which involves using 2 fingers to provide compressions on the baby's chest, as shown in the pictures here. If you're two rescuers, you can use the thumb technique where you circle your hands around the baby's chest and use 2 thumbs to provide compressions. What is the compression depth for infants? It is 1.5 inches or 4 centimeters, whereas for adults, it is 2 inches or 5 centimeters. Now, children also may suffer from choking, and the process for resolving this is different than adults. Where in the adults, we provide the Heimlich maneuver. For children, for infants, I'm sorry, we do 5 back slaps and 5 chest thrusts to try to get out the item that's causing this choking. Now, if just like in adults, if the infant gets unresponsive with the 5 back slaps and the 5 chest thrusts, CPR needs to be started. And also, before breaths are provided to the baby, we need to look in the baby's mouth, and if we can visualize the obstructing object, remove it with our fingers. If we don't see any object, provide breaths as usual and continue with CPR. Do not do a blind sweep of the baby's mouth to try to look for the obstructing object with the finger and pull it out. That might push the obstructing object further back and lodge it even deeper in the baby's airways. All right, this is the end of the video. I hope you found it helpful. Please like, share, and subscribe, and I will see you in the next video.